Okay, welcome back, guys, to this video where we're trying our best to differentiate between GERD, acid reflux, heartburn, um, acid indigestion, reflux disease, and gastritis or gastric ulcer. So if you haven't watched my video where I talked about GERD, I need you to go watch that. But just a brief review of GERD, because in this video I'm going to be speaking more of gastric ulcer or gastritis. Okay, a brief review of GERD: acid reflux, acid indigestion, chest ulcer, sorry, not chest ulcer, chest heartburn. People call it a lot of, they give it a lot of name. Okay, but when they come in, they speak to me, I'm able to differentiate when I ask for the symptoms or when I take the health history. So whatever you call it, if you know you've been having this heartburn, especially when you're done eating, you have this heartburn, and then after some time it subsides, and then you go about your activity, that could be acid reflux, indigestion, or reflux disease. Okay, so a brief review of acid reflux. Okay, remember our banana is illustrating the stomach. This is actually the shape of the stomach. Acid reflux, two problem. One, you have less acid here, so if you want to take care of it, you eat food that will actually boost acidity, like ginger, like citrus food, apple cider vinegar. Then changing lifestyle, your food that you eat that can reduce acidity in your stomach. So watch that video, you see a list of food that I made there so that you can make those changes. And then the second cause is here, the sphincter, the ring that separates your esophagus and the stomach. Whatever you eat or whatever you do or whatever that causes the sphincter to be open, causing acid to back up each time you eat or when you're relaxing, that's acid reflux. Acid reflux, heartburn, the problem is in the esophagus, not the stomach. Okay, so for excuse me, so for that, make sure you're doing all that. For acid reflux, you're changing your diet, getting a lot of probiotic yogurt, ginger, citrus food. You work on that, and when you work on that and you're still having, if the symptom gets worse, then you should seek emergency treatment or go see your doctor. Do not wait, because that might be gastric inflammation or gastric ulcer. I know some of us quickly go over the counter to pick up like omeprazole, the PPI or the H2RAs to treat. If you have been treating yourself over the counter and you still have this symptoms, please go talk to a gastroenterologist, a GI doctor. Remember, those medications, the PPI, the omeprazole and co, you're not supposed to use that long term. It's for only short term, like 2 weeks or 3 weeks, depending on your symptoms. Okay, so let's start with gastritis, gastric ulcer. So for gastritis, gastric ulcer, you have too much acid. Remember, GERD, you have less acid. Okay, for gastritis, gastric ulcer, you have too much acid. The pH of your stomach environment is less than 1, which means very, very acidic, too much acid. Okay, so the treatment pathway will be based on what? Reducing acid. That is why your doctor gives you the PPIs, the H2RAs. That's why your doctor gives you that, because they are acid blockers. They'll stop your stomach from making more acid while they treat the ulcer or the wound. And then after some few weeks, you can go back in eating your regular food. And remember, because your stomach needs the acid to survive. That's why you don't be on those medications. You are not supposed to be on that medication for a long time. All right, because if you stay on those medications for a long time, the protective power of your stomach, the acidic, remember I said the acidic environment protects you from unwanted bacteria You can have pneumonia, you can have some bacterial infection. So when you're on that medication for too long unsupervised, you are at risk for pneumonia, bacterial infection, weak bones, osteoporosis. You are at risk for losing a lot of vitamins in your body, and you can also have pneumonia or also have dementia being on those medications for too long. That's why you should follow up with your doctor. Don't just go over the counter to pick up omeprazole or pantoprazole and begin to take that. Okay, and on the other hand, don't stop the medication suddenly, especially if you're on that medication for a long time, because you can have a rebound effect. Okay, make sure you work with your doctor to know what's suitable for you. Okay, so gastritis, gastric ulcer. This is the stomach, right? So the trouble is within the stomach here. So here, what happens is when you have too much acid, remember that too much acid didn't just start. Something is the root cause. It could be diet, most of the time diet, but let's list diet. 2, you can have stress, too much stress. Then if you've been high dose aspirin, which is an NSAID, if you're on NSAID like ibuprofen, the Advil, the diclofenac, naproxen, if you're on these medications called NSAID, anti-inflammatory pain relievers, if you're on this medication for a long time, they can start irritating your stomach wall, right, and start eating up the stomach wall and causing also wound in the stomach. That can be a cause. All right, stress can be a cause. Be on those on NSAIDs for a long time can be a cause. Then we have this bacteria called Helicobacter pylori, H. pylori, that you can get from food, on clean water. That bacteria can actually begin to eat up the walls of the stomach, and if it causes that wound, the acid in the stomach can also start eating up the linings of the stomach. So for helicobacter, which I see a lot, with that they do a stool test, conduct a stool test. If that bacteria is in your stool, they not only treat you with PPIs like the pantoprazole to control the acid, they will treat you also with antibacterial to take care of that bacteria. Like 4 medications, you're gonna be on that for like 2 weeks. So that's why it's very important. If you've been self-treating GERD, acid reflux, and you're still not getting relief, you should be thinking more on the line of gastritis or gastric ulcer. So that's why it's important for you to follow up with a GI doctor, okay, a gastroenterologist, so that they can conduct like an endoscopy or even begin a trial of those 4 medications, antibiotics, pantoprazole. If it's not working, then they can send you for an endoscopy where they'll put a camera down in your mouth to check the walls of the stomach and the intestine. Okay, so that GERD, gastric ulcer, when the acid is too much and it begins to eat up the lining of the stomach, that's one you need urgent attention. Okay, you cannot self-treat this. You need to seek urgent attention, because they'll check your stool for that bacteria, or even start a trial of antibiotic and acid blockers like the PPI and H2RA. Okay, so that's basically the difference: GERD, gastritis, or gastric ulcer. So for gastritis or gastric ulcer, when you take, because you have too much acid, when you eat citrus food, or maybe you take tomato, that can worsen the pain. All right, that's how you differentiate, one way to differentiate that. So food, also stay away from junk food, high fatty food, processed food, fried food. And if you are under high stress, work on the stress level. If you are long-term or high-dose aspirin or NSAID medication, talk to your doctor. They can give you something to protect the stomach from the acidic effect. And so caffeine, take away caffeine. Another good thing you can do with gastritis or gastric ulcer, remember with GERD, acid reflux, you can go ahead and take apple cider. You can go ahead to take citrus food. You can go ahead to take probiotics. You can go ahead to take ginger. It's not gonna hurt you. With gastritis, gastric ulcer, you stay away from citrus food, spicy food, stay away from caffeine, stay away from fried, all those stay away. All right, like for fruits, stay away from that. But when you're done, when you've completed your treatment, or when you have treated the flare or the acute phase of that, you can go back on taking your citrus food. You don't have to stay away from your spicy food. You can go back after a few weeks, like 3 weeks of completing the course of treatment, okay, of gastritis or gastric ulcer. So you can go ahead, but you should start gradually, okay, because you need those nutrients in your citrus fruit, okay. For gastritis, for gastritis, what you don't, like I said, when you have the acute flares of the pain in gastritis and gastric ulcer, you temporarily stay away from citrus fruit, spicy foods, okay. When you're done taking care of that acute phase, you can go back on the food you enjoy, healthy food that you enjoy. So one food you can eat during the acute phase or when you have the flares or the pain of gastric ulcer is cabbage. Green leafy vegetables that are high in sulforaphane, that has a healing or soothing effect to the stomach ulcer. So you can make cabbage juice, not with the fiber now. You don't need the fiber now. So you can make the cabbage juice, green leafy vegetables, make a juice out of it and drink. That is very soothing to the stomach, okay. You can do that when you are actually having the flares or the gastric ulcer. That helps, but stay away from all those spicy or things that will increase the acidity of your stomach, because that's what you're taking care of during gastritis and gastric ulcer. And follow up with your primary care provider so that they can treat it with a recommended treatment plan, okay. So I hope you enjoyed this video, and make sure you're also taking your vitamins, also your vitamin B, C, vitamin E, just to make sure you're keeping the stomach or your gut environment healthy and giving your body the right nutrients while you heal. And if you have any questions, go ahead and ask me through my Instagram. And one more thing, I know some of you have been asking me to do an intro. I'm still gonna do that when we have like a larger community here. But if you want to know about me, go to my webpage. I think the link is below this video. Go to my webpage. You're gonna know all about upstream health, upstream to downstream, okay. Go there.org and you're gonna know all about us and a lot of other things that we do, okay. So this video or this platform, it's free when you subscribe, just for you to get some healthy tips. But if you need other services, you go to our website and fill in the intake form. All right, so see you and stay blessed. Bye bye.